We are at Park Avenue LASEK, New York's only 100% non-invasive laser vision centre. Today we are graduating one of our favourite patients. I say that a lot, but this time I actually mean it. This is Rex. He's negative, what, 11 before?
11, yeah.
So, Rex, I mean, you're seeing better now than you did in your glasses contacts. Why did you initially come to us? Did you have an inkling that we might be able to treat you when other places couldn't? Or just tell me kind of a bit about the process, because you're like beyond LASIK parameters, but you're well within our parameters. So just kind of give me a sense of how you got to this point.
Yeah, so I mean, the first step was clearly just taking a survey of the options available. And the first place I went was TLC, mainly because they were the one that was most known, I guess, to the market. They're a publicly traded company. So I went into a TLC center, and I got the sense that from them, they said that I was a marginal candidate. But I got the sense that they would be out of their comfort zone, I guess, doing my procedure, being that I was negative 11. And the way it works, as patients will come to find out from meeting you, Dr. Chynn, is that the thickness of your cornea is kind of a limiting factor on how much they can treat. And because LASIK involves a cutting of a flap, the amount of prescription that they can treat, you know, is marginally at my level, but really more comfortably far below.
Right.
Whereas at Park Avenue LASEK, I mean, there is no flap cutting, right? It's a different procedure. And so that resource, the corneal thickness, isn't spent on the cutting of a flap until you can treat further prescriptions, right? So 11 is sort of well within the safe zone, which can go up to like 18, 19, negative 20 even, right? And so that's the difference here. For me, a LASEK, LASEK procedure is really the only option for me, and this being New York's only center, you know, is a happy coincidence, I guess, right? That I was close enough to a place that could actually treat me.
Yeah, exactly. And I know you do some like contact sports as well. Have you been back boxing since?
I have not, only because of work being too busy. But with this procedure, I mean, I would be able to go back and go into boxing as I had been before, without any risk to my eyes, right? Whereas, you know, you hear stories of people who've gotten a flap cut and the flap comes loose because they get jostled with the face from like a boxing or contact sports or you know, there's a story of a guy climbing a mountain actually when the pressure or the lack
of scuba diving as well.
Scuba diving, yeah, you're right. So I mean, in this sense, because the tissue is healing back without a flap, there isn't that complication or risk of complication really. So yeah,
you know your stuff, Rex. You know your stuff. How would you say the kind of the process is? I do want to be clear to people out there, once you're negative 11, now Rex is very patient, you understood, clearly he's a smart guy, you kind of understood the process a little bit, but yeah, I mean, you're seeing better than you were in glasses or contacts. Yeah. I know you have to keep your eyes closed for the first few days, so, I mean, I know I did it myself, it's a little bit boring, but I guess you'd be of the opinion that a few days sacrifice at the start is far more beneficial than doing a riskier procedure with a slightly quicker recovery.
Yeah, I mean, so I'm better now than I ever was in contacts or glasses, right? The best with contacts or glasses was 2035, I think, and now I'm 2020.
That's awesome.
Yeah, and so it's, look, it requires patience and discipline, right? So there's a regimen of drops and of pills and of things. You have to follow it, right? Like there is, I'll put it this way, there are a few things in life that are this predictable, whereas if you do the things, you will get the results, right? Here there's a sheet, every visit you get a new sheet that tells you what to do. If you do the things, at least for me, I got the results. Few medical procedures are at that level of development where things are this predictable, but in this case, you know, yeah, it was, right? And yeah, so the first week for me, I basically kept my eyes shut as much as possible, and it was worth it. Yeah, I mean, a week in the course of a lifetime is nothing. Yeah.
So finally then, any words of advice for maybe anyone who didn't think they could get LASIK, the eye one, and any advice for people maybe thought that once your prescription's as high as yours that there was no hope? Do you have any advice for those sort of people out there?
Yeah, it's the best money you'll ever spend, hands down.
Yeah. It's really a lifestyle thing, right?
Yeah.
Not having to worry about this all the time.
Right. It's one less thing to have to think about contacts, you know, even getting new glasses, right? Or, yeah, it's just one less hindrance to living an active life. Yeah.
You're a pretty active dude, so man, thanks a million for agreeing to speak to us today.
Yeah, for sure, of course.
Yeah, it's been a pleasure having you as a patient, man.
Yeah, I'll miss you guys.
Definitely. So, yeah, anyone out there who doesn't think you can get it done, give us a call, 212-741-8628. Alternatively, check out parkavenuelasek.com. So Park's in Park, Avenue's in Avenue, spelled out LASEK, because we're doing the non-invasive technique. Thank you very much. Thanks to Rex, and yeah, give us a call. Thank you.